Well, welcome everybody. Welcome to the next episode of Developing Through Change. We have special guest today, Helen Smith.
Hello.
Would you like to be introduced as Dr. Helen Smith?
No, Helen's fine.
Yeah.
Helen's fine. There you are.
And we've got John. John is just back from his amazing trip up Everest. So
we've been all over the Himalayas. Been away for 3.5 weeks. My biggest problem was my daughter, who's 6.
Oh gosh.
So you would have seen, lots of you have been following, we had the Paddington.
Yeah.
So at Heathrow, I found this Paddington bear, and I phoned and said, Paddington's going to take me, Heidi. And that brought her into this incredible adventure with Paddington. And every day, it wasn't interesting what Daddy's doing. What's Paddington doing, Daddy?
Yeah.
So it was wonderful. I think if anyone's going away to do anything like that, and you've got young children, take a teddy and make the teddy take you. It was a wonderful experience for Heidi, and now she's got Paddington very proudly on her shelf, with a little picture of Daddy up in the mountains and all her prayer flags. And everyone in her school knows that Daddy's been to Everest Base Camp and Island Peak, and I got taken to see the teacher.
Oh, brilliant.
So
brilliant. Well, we're very proud of you.
Thank you very much. Thank you very much.
Raising all that money for charity.
Yeah, I mean, we're £4,300 now. I mean, it's an incredible amount of money for West Bank. And the nice thing about money that we raise like this, it's not attached to anything.
Yeah.
Because what we see a lot of with charities, isn't it? They put a bid in for some money, and then they have lots of stipulations where they have to meet this. And sometimes that's handcuffing them what they can do with the money.
Yeah.
So they're really thrilled. And we're going to finish it off with an afternoon, evening with Andy and John. We're going to go over with some of our mountain gear, and we're going to have lots of photographs and some pickings, and some of their clients and things are going to be there. So it should be a nice afternoon.
Fantastic. What
Really
fun.
good, really good. And we will find a way to connect your journey into Helen's talk in a minute. I'll try.
He's been planning this, hasn't he?
I'll try and find a way. But firstly, Helen, we just need to understand a little bit more about you. So I know you quite well, I feel, and my summary might miss out things. So I'll have a go. I think of you as like an absolute leader in the areas of patient safety, somebody who cares so much about improvement within healthcare, somebody who has a deep clinical background, has been like a medical director, has worked at both kind of system, then region and national level. Possibly you've done stuff internationally. I certainly know you've worked and travelled into America a fair few times, exchange
You've been
learning.
very busy, haven't you?
I have.
Yeah. And a variety of different organisations.
Yeah.
You're now a board member as well. You're working down in Plymouth,
Yes.
a really important hospital in the region, on the board. But how else would you fill in the picture? How do you explain what you've done, what you've achieved? Or do you shy away from ever?
Did you find this really hard? I find it really hard when people say it to me, because you're sort of like, I just do my job.
Well, it is interesting. So I was reflecting this morning as I was driving in, thinking about questions. So I think I always describe myself, actually, I'm an accidental psychiatrist, but I'm also an accidental leader. So I never intended to be a leader of any sort. And in fact, my leadership journey started when I've got four children. I had 4 very small children at the time. We'd taken a decision in our family that I would work part-time. I was a jobbing consultant, forensic psychiatrist. It's working 3 days a week, which I absolutely loved and have loved the whole of my career. I absolutely love my clinical job. And then the chief exec, who must have seen something, Ian Tully, must have seen something that I hadn't even thought of, and sent me off to Boston and to the Institute for Health Improvement. And I learned, I had no idea what I was going towards, because my job was much more around sort of mental illness and public protection, and actually this was a complete turning on its head and starting to think about patient safety in a hospital sense. And it just, I had an absolute light bulb moment when I was there, and worked with, there were no other people from mental health apart from our small team. And I just thought, this is amazing stuff. And that started me on a journey of exploring things that are way outside medicine. Yeah. So expose me to industry, to organisational psychology that I wouldn't have heard of, all sorts of things. And I got a bit of a bug. And so I started a bit of a journey of self-learning, I suppose. I mean, it sounds very twee, but there were just things that really, really interested me. And I went and started exploring them. And then people started giving me jobs that, I started moving up in leadership stuff and doing more regional jobs, and I was allowed to. One of the joyous things about my career has been I've been allowed to play with the things that I've been learning, and that's I've always had clinical curiosity, but curiosity around the things that I'm reading and what does that mean for me. How do I make that work in the system that I work in has been one of the things I've really loved, and I've worked in systems that have allowed me to do that. So I've been very supported by fabulous leaders, amazing men in my life actually, who have really supported me on the journey. And so I've kind of I haven't ever gone out to get things. People have said, Helen, do you fancy this? And I've also been really lucky, because bringing up my kids has been a really important part of my journey for both myself and my husband. And so I've always been able to say, it's probably a bit of a luxury. I can say, actually, yeah, I'd love to do that job, but I can only do it if, and that so fit in all my other things that I needed to do. And I've never had a problem with that.
Yeah,
that's a real tribute to who you are, though, isn't it? Because not everybody would have that ability to be able to say, I can fit it around my children. If you want me, I can do that. That's incredible, isn't it?
Yeah,
it's a really good position to be in.
But it's I have a privileged position, so I can say that because I have a husband who has a good job. So so it's all. Let's not pretend this is all about me. I'm in a very privileged position where I can actually say those sorts of things. Yeah. And I think it's a bit scary when you first start doing that, because it is different being a woman in the system compared to a man. And actually I think it is a bit scary when you first start having those conversations. But I think once you realise that they go okay, and so I am flexible in the way that I work. Yeah. I feel pleased that I have been allowed the opportunity, and that allows me so I can give back in gratitude for people's flexibility with me, I think.
Yeah. And just a couple of things I wanted to say to you. So you do amazing work of depth. Most of it you can't actually talk about, I imagine. You do very confidential work. Looking sometimes into investigations, but sometimes with teams going through trauma and difficulty. But in all of the work we've done, it's just been so much fun.
Yes.
Yeah. So we've always had fun, which isn't that doesn't happen with many people. So
but I feel passionately about that. So it's almost like having fun is kind of a side issue. But actually, so I don't take myself very seriously, and I enjoy having fun. I've always said, actually, right from the word go, that I have to enjoy the job that I'm doing, have fun, and I love working in teams. I love working with the people that use our services, and there's always an element of fun within that. And I think it's hugely underrated, having fun. So if you can have fun, people are in a different state for learning. So what we want to do, whenever we do any learning together with teams, we want them to be as open to that learning as possible and as creative as possible, because a lot of the learning that we do is around trying to solve very complex problems. And in that context, creating an environment which makes it safe to have fun and to actually facilitate having fun is really important. Yeah. So important for the learning, but also think that people will come back again.
Yeah.
You get the best out of people, don't you? If they can feel relaxed enough to have a bit of fun whilst they're doing it, they will work in a much more efficient way.
Yes.
There's nothing worse. I mean, I saw a thing the other day, and they were saying, literally, you are working for 2/3 of your life, so enjoy it. Yeah. So you do have to wonder, don't you? If you're going to go to work and you hate it, change it.
Yes, absolutely.
But we might get into it later, but fun arises from a position of safety.
Yes.
Doesn't it? And so you are highly adept at using your skills to create the safety from which then the fun can naturally happen.
Yes. Yes, I think that's true. And I think a lot of the skills that I use now, so I don't do any clinical work now, but the skills that I developed in the context of working with a population of people who didn't start off wanting to work with me, didn't want to be in the place that they were, had a very difficult time, have a life full of difficulties with statutory services. There is a way that you learn to work with people, to engage them, to get them to trust you, so you can work alongside them, that actually really sets you up it's really set me up for the subsequent work that I've done. And it is all about, you and I have spoken a lot about this previously, but psychological safety. Yeah. How do you create a psychologically safe space for people to do whatever you're wanting to do?
Yeah. So it's now time for that segue that we set up earlier, because we want to talk about culture and its role. And I'm actually travelling down to Cornwall after this to teach on some leadership development with some people kind of emerging leaders within the charity
Yeah.
sector, and they've asked me to talk to them about strategy. And as I've been reflecting on strategy and it over history, there are many models that use the sort of mountain climbing a metaphor.
Yeah.
And base camp's a very significant one. You know, we'll get there, then we'll get there, and we'll achieve this. But what I'm noticing with the individuals that I am now working with, who are often generation below, is that metaphor holds less and less now. It's more about nature-based metaphors. Ones where we talk about interdependence, ecosystems, things emerging, as opposed to, you know, the CEO as the chess master who makes the intelligent choice, or we plot the course and then we go in and then we deliver it, because workplace is far too complex and the working environment is. So as much as we like climbing mountains, that sits in a world where things might be complicated at best, but they don't get overly complex. Your world, Helen, I think, when you work with teams, it's heavily complex because humans are deeply involved. And you'd mentioned that you often think of culture like a forest floor, like the rich part of the system. And so I think we should maybe get into that. There's this obvious quote we hear over the years, culture eats strategy for breakfast. But how important do you think culture is in terms of patient safety, or in terms of improvement, in terms of clinical outcomes? You've seen it from all sides, so just talk to us a bit.
Do you think there's a stage before that, though, before the actual work? Because, as you were saying earlier, and you're creating that culture from the start, aren't you? You can't walk into a team and just drop yourself in and expect everyone to work in that. So you almost have to set the culture with your team. From my point of view, that's what I'm sort of thinking, saying, you know, how do we get onto these shared values? How do we get onto this shared ethos that we're going to treat each other in a certain way? How do we do this to make sure that when we do the next step, we're set up for that? I mean, you probably just do that very naturally, but I think it doesn't come naturally to everybody, does it? So, I mean, is there some thoughts around that before we get to the work part?
So things might appear natural, but I think they're very intentional. So,
of course.
There is a real thing about intentional leadership, and I think so. I'm not quite sure if I'm going to answer your question, but this is what I'm thinking as you say. So one of the things that I've learned, that if you want to influence a system or influence people working in that system or create psychological safety, all of these things, you've got to listen to what people say. So I rarely start, there are pieces of work that have talking to the people in the system is fundamental to getting the work done. However, there are other bits of work that I do where it isn't fundamental, but I do it. And so I rarely work on my own. I generally like working with other people. But we often spend some time just listening to people, just going and creating some space and just listening. Tell us, you know, what's it like from your point of view? Tell us what's great about this place, what could be even better if, you know, very appreciative way of working with people, so that we can so we have a view of most systems that we go into to do work in from the outside, but it's a very different perspective on the inside. And some of it marries and some of it doesn't, and you get some, so hear people's stories. And if you hear people's stories, you can piece together and understand where people are coming from. And then that allows you to start thinking about the culture, which I absolutely is fundamental. And I've never, ever worked in an organisation that is running into trouble that hasn't got a problem with its culture. And I always describe it as the soil. It's the soil from which everything grows. And if you don't get your soil right, you can have a few shoots of recovery, but they're not, it's like saying seed on fallow ground. They're not going to last. So you've really got to pay attention to that soil in order for things to progress.
And so you start with listening.
Yes.
And then what I assume that builds trust.
Yes.
And then from trust comes openness.
Yes.
And now you've got some things to work with.
Yeah, very much so. And I think people are always a bit surprised when you're interested in what they've got to say, particularly because we work with people. So you know, I would be quite senior in systems that I would have had previous roles that were quite senior in the systems that I go into, but we work with people. So that we try to get rid of the hierarchy in a sense. So we work with people right the way through the system. So it's important that people feel that their voice is important and we want to hear what they've got to say. So I think it's building relationship, building trust. And then it's thinking about, so I am absolutely clear, and I've learnt this the hard way, that I am not an expert. My expertise is not in the subject matter people think it is in. It is a bit in that, but perhaps my best expertise and the people that I work is how to facilitate other people sharing their expertise. So I've really shifted my position over many years that I'm not the expert that stands on the stage that knows all the answers. My job is actually to unleash the expertise in the room, because that's where they're the people that are going to solve the problem. They're the people who have the expertise, understand the problem, and the job of, I think my job quite often, and the people I work with is to facilitate, create environments, use tools that help release the expertise and enable people. And sometimes, I'm just reflecting on a piece of work I'm currently doing, an absolutely incredible team of people in a very complex organisation, but completely, all hugely creative, great group, but completely constrained by imaginary constraints. Mm-hmm. So actually, what we could do was we could just press a few levers and say, don't worry about that, we'll sort that. No, that's not something to worry about, we'll sort that. Mm-hmm. And just by flicking a few levers, we unleashed their own leadership and creativity. So all we're doing, most of the time, all we're doing is facilitating.
Just
facilitating
people to move.
Allowing them to be brilliant. Yeah. Unleashing their creativity. I'm sort of reflecting, Dan and I have both done work with a woman called Becky Margiotta from the Billions Institute in the States, and she talks about social change and unleashing creativity, unleashing your people in a sense, and that really resonates for me. So I'm always thinking about, so how do we unleash the creativity? Where is the creativity? Where can we tap into it? Where can we support people to be the best they can be, really?
Which is, I think of it as you're doing something to make the invisible visible.
Yes.
So the invisible undercurrent of, we can't do that, it's not done round here, that never worked last time, so we won't try it again. Or even like deeper levels of even if they're saying this, they don't actually mean it. Even if they're saying they believe in me, the overarching belief in this organisation is that the people aren't good enough.
Yes.
And that's all invisible, and it impedes people day to day, doesn't it? So it's like your fallow ground.
Yes.
But what I suppose what I think people would love to know is, how do you even start to make some of that seen or find those levers? Because that's quite significant. That's deeply held. It's holding an organisation or a team in place.
I guess a lot of that comes from your first comment about all this listening, isn't it? Before you start making the lever conversations, you're really listening and you're really trying to understand who they are, what their background is, what they want to do, what they're passionate about, and where they're feeling and their pinch points are. Yeah. And then you're going away almost like a skunk's works and saying, I have listened to all these people, and we can see from all these people, these are the issues. Yeah. Let's just pull those levers and see what happens. Yeah. And I think there's some real value, isn't there, from being made to feel valued by someone listening to you. So quite often people will say, I really want to talk to you, and you can see in their eyes they're glazed over, they're not really taking any notice, they're just having a one-to-one with you and ticking a box. And there's a very different thing between having a really meaningful conversation where you can get something out of it to tick in a box. And I think that's where you probably come into your own, it seems.
Well, I think so. I think so. One of the things I think that we probably do reasonably well is we meet people where they are. Yeah. So we don't judge them. So there's a lot of judgment goes when systems are into trouble. There's a lot of judgment that actually is happening in real life, as well as people perceiving it. So we listen to people where we are, and we don't judge them. We just take that position and think, well, what can we do about it? And to be honest, there are some things that are dead easy. So if you've been but the people I work with have been executives in organisations, so we kind of know the things that are easy to do that people don't know are easy to do, and so it's easy for us to say, don't worry about that, we'll sort that, because we've got a relationship with the executive team because we've been commissioned by them, so we kind of know where they're coming from. So there's that bit, and there's the other bit we have, which we judge when we have this conversation, but actually is to put some responsibility back onto the people we're talking to, because there's a lot of sort of learned helplessness and people get into sort of a bit of a victim space, and say, talk about narrative. So stories are incredibly important, but talking about the narrative of the place they work. So you're giving this stuff narrative of, but actually you're in charge of the narrative. You work here. This is your service. These are your patients. What are you doing? This is your narrative.
I think that's a really interesting point, actually, because quite often, I mean, we see quite often as well within social care, when you have like a resignation, it is broken.
Yeah.
You quite often you'll see that someone will say, "I'm leaving this company.
Yeah.
It's this company's fault," but then when you dig back into it, and actually, it's the personalities of the team.
Yeah.
It's not the company that's giving you that directive to act that way. It's not that company's directive or policy to be, I don't know, a bit backstabby or a bit sort of, toxic. So it's really up to that team, isn't it, to understand their own dynamics.
Yes.
And come round to a bit of maturity.
Yes.
And say, how do we fix this to make
Yes.
it a nice place to work, so we can then thrive and make our business better, and in turn, obviously, hopefully get some better promotions and bits and pieces.
Definitely. And I think understanding, again, taking each other where they are,
Yeah.
understanding what the things are they're really good at, and balancing those out across the team, and valuing people for their strengths, working in their genius. So there's a bit of that. When people get very distressed in organisations, the responsibility gets pushed out. Actually, start owning the responsibility a bit more yourself, and thinking about what that means, about how we choose to work together, what narrative we are going to give the world about what we do and what our service is all about. And actually just flipping those sorts of switches does change the way that people think, and helping people to re-enable themselves. And again, all it is facilitation.
Yeah.
Well, it is. However, they need to believe that the person who's in their corner, which is often you, actually does have their best interests at heart. The word that comes to mind from what you both said is agency.
Yes.
Trying to help somebody realise they still have agency, they still can affect their own situation. I've been doing some work recently with an organisation called the International Futures Forum, and they then go one step further and they say, hope arises once you have agency.
Yes.
And I think that's like really nice. And it's almost like momentum also. If you don't realise that you have power over this situation and you can affect the change, you can feel stuck.
Yes.
Therefore, you think maybe I have to go. And sometimes you externally attribute, it's down to them. They aren't good enough. It's not safe for me here. I'll go. When you have got agency, it's like, I might be able to change this.
Yes.
You try something. If it does change, I'm more hopeful. Let's try something else. But to create that environment is quite tough.
I think you have to, for me, to jump in there, I think you also have to understand that sometimes you've got to break it to fix it. Sometimes things have got to a level where you almost have to make it a little bit worse. It feels worse to go forward, if you know what I mean.
Yeah.
So you've got to sort of ruffle a few feathers and say, we need to talk to you about this. You're not going to like it.
Yeah.
And it's really uncomfortable to take them forward or for them to exit. And you don't ever really want somebody to exit. You want to try and bring them forward with you, but sometimes it's really uncomfortable. Sometimes it's really hard. It's not always plain sailing to say we're going to just turn this team and flick it on its head tomorrow and turn the levers on. That's the aspiration, but people have feelings and emotions, and sometimes they're really well ingrained. It might have been 6 months, a year of a certain behaviour that's dragged them down to a level. So to spin that on its head quite quickly is sometimes quite hard, and I think it's really good to, like you say, almost acknowledge that and give it ownership back to them and say, we can see that it's been hard. How do you perceive we go forward, and what would help you? It's a tricky one, really.
But I'd also add to that. So there is, back to the giving people agency and control. I think it's really simple, but help people to understand what they can and can't control, and the stuff you can't control, that's over there somewhere. Can't control that, but actually let's think about what you can control, and thinking about what does that look like. So how do you do things differently? What can you do? And actually that builds the agency again, and it gives people hope, and actually people really start motoring and moving.
I think so. It also gives them a bit of a map and directions, because sometimes you can feel so lost, can't you? In that moment where you are in some sort of employment crisis, and you want to be pulled into a team, you can be really, really lost. And it might just mean that Dan comes in as a independent parent says, well, like you, it's very easy. Don't worry about that. That's a really easy switch to fix. But for that person, it's really entangled. It's really complex. It's really hard for them to see anything past. I don't want to come to work today. I don't really want to be part of this team, even though they're brilliant. And it just needs a little bit of tweaking to push them forward and create that really positive, trusted space that you've referred to a couple of times.
I reckon we should stretch ourselves a bit though, because I'm getting the sense that sometimes, Helen, when you get invited in, there's already a slightly enlightened view that we need some support here.
Yes, yeah. Well, yes, yeah.
And then so there's somebody already thinking that something's not quite working.
Yes.
But many of the listeners probably feel that they're in environments where that hasn't been realised by the people at the top. And they themselves are maybe they're gripping harder, they're demanding more update meetings, more use of performative approaches, they're starting to really question whether people are any good, and they haven't yet realised that culture is an issue. Like, what would we do in those circumstances, and what might we advise? Do you ever get caught in, like, is it better to work with the individuals at the front line or the people who might be in the most senior positions, or do you end up saying it's both? Or
So I think one of the things that I think and we know happens is that when people feel that they're running into trouble, they grip tighter, they provide stronger leadership, and they become further away from the place where the work is done. So my experience is in health and social care, but I don't think it's any different elsewhere. But there's something about, it's back to some of the things we were talking about right at the beginning. Your expertise lie with your people, and actually it's at times when you feel like that where you need to most release your grip, provide direction, provide the infrastructure to allow your team to be at their very best, and recognise that your team are the people with the expertise. You need to just facilitate and create the space and the headroom, because I think that's another thing that often people don't have enough headroom to just try something different. So that, I think that's the job of leadership in those, is to unleash your people again, create the headroom, create the thinking space, give direction of where you want to be, really make sure you're all understanding the problem that you're trying to solve, and then do it together. So it's it's a different leadership style, I'd say.
Do you think there's a place also where you have to acknowledge sometimes that people just aren't the right person? You know, there's lots of teams, aren't there, that people have been brought up through the ranks and they've ended up in a team, and sometimes they've been over promoted and they're there and actually they're really struggling, and sometimes you almost need to say to them, do you really want to do this, and not be afraid to let them go. Sometimes, especially I've done it myself, where I've had so much work on, I've gone, I really can't afford to lose you, even though it's not fair on them to do the job, because they're struggling. They're not doing it very well because they're brilliant in lots of ways, but this particular role is not fit for them. And what I've seen is when that has come to a natural end and we've parted ways, good, bad, or indifferent, you can then reflect on, actually, it's more of a hindrance to have them trying to faff through it than have somebody new in and actually let them do something that they really are inspired about. Because it's so hard, isn't it? Because you feel really, I've been promoted, it's wonderful, but actually when you get the job, it's not always what it's cracked up to be sometimes. So is there a space there where it's really almost a message of caution to directors and managers to say, don't be afraid to replace somebody if they're not right for them as well as you?
So I would slightly reframe that.
Yeah, reframe it, because I'm not the most tactful person sometimes.
Well, I think so. I think, I mean, it's very, what you describe is very true in the NHS, where people get promoted because they're good at something into jobs that nobody's ever trained them for.
Yeah.
And I can think of loads of occasions where really fabulous people are promoted into jobs that they have been extraordinarily poorly prepared for, and what a surprise they don't succeed. And they end up, and this is frequent in organisations where they get black marks around them and this person's rubbish and blah de blah. And I've actually often ended up in teams or managing big teams whereby what people might describe as the duffers get chucked into the team. Duffers. And actually, they feel everybody knows when they're doing a bad job. So nobody thinks they're doing a good job when they're doing a bad job. So people, absolutely know and feel that. And actually, there are many occasions where again, it's creating the conditions.
Yeah.
You can absolutely create the conditions for those people to thrive again. And so I think there is never enough responsibility taken by leadership and management around how do we make sure that a person is fit to do the job. And if they're failing, let's stop and think, is it because they're a bad person or is it because they're not well prepared for the job? Yeah. And I think, so one of my absolute mantras around any of the work I do, whether it's reviews, improvement work, or thinking about exactly the things you're describing, John, is that nobody comes to work to do a bad job.
No. I really agree with that. I mean, I just know, for me personally, I know my limitations, and I could quite easily get a job here, and I know I probably couldn't do it. You know, I would struggle with it. But I think there's something, again, going back to a bit of ownership, isn't there? So if you are looking to get promoted and you're being offered a job, I think it's only fair and right that don't be afraid to say, how will you support me?
Absolutely.
What education will you give me to ensure I can do this? Because quite often you get thrown away and thrilled with, I've got a promotion, I'm getting a pay rise.
Yes.
And then you get dropped in it. And as you said, no real training. I think we see that a lot, I think, in nursing, don't we? Where they've gone out through different bands and suddenly they're a manager, but they haven't had the manager training.
I completely agree. And it's true of doctors too. And actually, and the other thing I would say, so you've got a lot of insight into this. I think lots of people don't have insight. So I can think of people that have been promoted. I think of medical in my world, where people get promoted into effectively management and leadership roles, and they don't know what they don't know what they don't know. Yeah. And it's only when they do the job that they suddenly think, I've got nobody's. Often, there's no job description. There's all sorts of craziness that goes on. And then I can think of numerous occasions where people have felt people get this nasty label. They're rubbish, they're hopeless, but they had no idea what the job was.
It's
Nobody
completely
supports
unfair.
them. It's completely unfair. And so whenever I talk to people, I'm supporting people who are going for other jobs, promotions in their roles. I do think about what development do you need. Be clear about what the job is. Yeah. What are the roles and responsibilities that you're going to have to take? What can you do, and where do you need some help? And be sure to ask for that, because you just say everybody is set up to fail in that context, because you don't do a good job for yourself and you don't do a good job for the organisation.
I think there's a bit of irony there as well, isn't there? Because sometimes the managers of these people, they don't actually know what they want them to do either. There's no job spec.
Yes.
You're brilliant. You've been doing so well. Go and set up this team and go and do this project for me. And then they say, well, what are the outcomes we're looking for? Well, you decide those when you do it. Yeah. Okay, well, that's pretty much setting me up to fail, isn't it? Because at some point you're going to measure me against something that you have no idea what you're measuring against.
Well, yes. Well, when I was first appointed, so my first, I can remember very vividly when I was first appointed medical director, I had no idea what I was doing. I was on a learning curve that was unbelievably steep. It was like your mountain. I felt, when I read your posts, I thought, I can recognise that experience. And it was sick-making. And anxiety provoking, and I made bad decisions, and I didn't really understand the system I was working in, the external system to the one that I was working in, and it was deeply, deeply unpleasant. Now I ploughed on through it, and obviously I'm still here, so I learned lots of stuff, but it was a very unpleasant experience, and it didn't need to be. It really didn't need to be.
I think going back to the base camp thing, I use that a lot, and I don't know if it's right or wrong, it might be quite old school. The reason I use that position is it gives me a safe position, because I'm in a safe position and I can go up and try a little bit, and if it doesn't work, I can come back down quite quickly.
Yes.
So I use that sort of mantra quite a lot, and I do it with my teams here. Let's just dip our foot into that bit of altitude. Or that doesn't feel very comfortable. Let's go back and start and reflect on that and start again. And sometimes it works, sometimes it doesn't. But I think you do have to be quite careful though, because you also need to know when to turn around. And I think that's like with any career, isn't it? Like you said, you went through all that, you made lots of bad decisions, but at the time you did the best you could do.
Yes.
Doesn't mean it's
very good sometimes.
Yeah, but you didn't know what you didn't know, did you?
Yes,
and that's the point here, isn't it? So you did the best you could do, and there would have been a point sometimes where you would have turned around and gone, I'm just going to step back away from that and reflect. And there's the people that can't do that run into lots of problems in there. So you need to be quite mature in your attitudes. Go, I'm not so gung-ho, I'm going to push through even when I can see that it's not going to work. And some people try to do that regardless. And I think from the outside, I don't know if I should say this really, but certain senior leaderships within social care and health sometimes do that. They push on regardless.
But there's also humility. So that I think it's incredibly important skill in a leader to be humble, to recognise when you haven't got something.
Quite
and this
right.
comes with experience.
Yeah.
Recognise when you haven't got something right, and actually be very. So I tend to be very, for reasons around creating psychological safety and flattening hierarchy and all of those things. I have to walk the walk as well as talk the talk, and I feel very passionately about that. So if I make a mistake or I don't know what I'm doing, I am publicly saying that, because if I can role model that, then other people will do that too.
Yeah, you do that very well. I've seen you do that.
But I really like the fact that you said earlier, your job isn't paraphrasing, your job isn't to know everything. It's about to know who does know the right things and letting them express
let
that.
them
Them shine, yeah. And that's a really great position to be in as any leader, isn't it? To say, actually, I'm just here to facilitate. You guys are the incredible people. But that does mean you've got to let your ego drop, because there's so many leaders who have an ego far too big for their boots.
Leave it on the shelf. It's not needed here.
So the question that you raised, John, about is it right sometimes just to move somebody on? I just want to add another angle to that, which is I get quite a few contacts or phone calls, if you like, from people who want some support, and they're often in the middle tier. They've got some line management responsibility. They'd like to be more strategic. They'd like to have higher autonomy. They'd like to move up, but they find that it's difficult. And they are so aware of everything that is going on around them in their organisation or in their system. And yet they almost feel like the people in the more senior positions think they aren't. But they see everything. So when a senior leader makes a call to say, I think it's time that this person leaves and they can't carry on here, how they go about that is so fundamental to the effect it'll have on the culture for everybody else.
Absolutely, yeah.
Because I had just a call just the other day, and the person was like, so this person's now leaving. We have no idea why, but we're all assuming these sorts of reasons. And it's like, that was not handled in an open way. Really, I had this joyous outcome once, which I was so stressed in the build-up to it. I'd employed an individual. He was really great, great fun to work with. But over time, it became clear that he was unable to perform the role. And through one-to-ones and through support, through discussions, and the fact that we had some trust, he got to that conclusion himself, and he felt able to say that. We were then able to then get to a place where I was helping him to find something that was more suitable for him. And at the end, he was saying thank you, and he was going on to something that was better.
And I think that's kind of where I was trying to get to earlier. It doesn't always have to be a bad ending, does it? Sometimes it's unavoidable because some personalities are personalities. But actually, if you're a really caring person and a director who cares about these individuals, to move them on in the right place is a really healthy thing to do. But what I've seen so many times is, from a director's point of view, they're scared to lose that capacity. They've got too much work on. They're like, I can't cope. He goes, I can't do that. Or she goes, I can't do that. Who's going to fill that spot? And it's a very selfish position to be in. But that also then creates a more of a toxic environment for the team members around them, because what they're seeing is somebody failing and nobody doing anything about it, which then leads that everyone saying, well, if I'm working really hard and they're getting away with it, why should I? Yeah. So you're creating this really perpetual downward spiral unless you do something. And it may well be that you can't fix it. It may be that you sit down like you have and said, let's work together to get you into a role that really suits you. And you can have a nice time at work rather than a really toxic environment, which is what's happening now. Yeah. It's a fine balance, isn't it, between being sort of a bit bullish at it or balancing it right.
This is your point about grip, isn't it? You can move to grip, you can move to try and hold it, but then you will create a whole range of sub-consequences that culturally might be an issue. Yeah,
and sometimes grip is important. So there are, obvious medical situations where you absolutely need a leader that's saying, we're going to do this, 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 and this, and we're going to do it in this order, and that's because it's mission critical at that time. But there aren't that many situations like that. And I'm minded, actually, when listening to you both talk, about Sidney Decker's works around just and restorative cultures, and thinking about what the position of the manager in the situation you describe. So just sacking somebody and putting all the responsibility on them fails that manager. Well, it's a blame culture, isn't it? Which is a very toxic place to be. But there is something about, and one of the things I love with Sidney Decker's work is talking about, well, actually, let's just remember the organisation employed them, thought they could do the job, were responsible for their training, did their mentoring and supervision. So actually, the organisation has responsibilities around this individual, and everybody can see that. So sacking people, whilst it might seem the right thing to do, or moving people on quickly, there's a footprint left. They don't go away, and so there's. I think sometimes people don't fully appreciate that.
Yeah,
there is definitely a fine balance of making it right.
Yes.
I mean, I have had some employees in my past that doesn't matter what you do, they just have to have to break ways, and there's always that odd person, but it's very small amount of people that happens with, and I tend to agree with your approach, saying, is there a way that we can do this amicably, that we can help you?
Yes.
Because actually, what you want someone to do, it doesn't matter if you're a private company like Unicare or the NHS, to walk away and say, actually, they're a fantastic company.
Yes.
Didn't work for me, but they're really good. That's what you want, isn't it, at the end of it?
Definitely.
So in a minute, I am going to move us into a lot more positive part of this conversation. But just want to stay a little bit more. So some of the work that I'm doing at the moment, Helen, is working with teams whereby they feel that culture across all levels is impeded.
Yes.
And therefore, at certain points, they will deliberately absent themselves. Like, I'm not going to that meeting. Actually, I'm not going to come in today. And then at other points, they will say things about colleagues, which shows such a low level of trust that they have actually started to view a colleague who has been a friend or is certainly, as we know, they're obviously a human being, but they're starting to see them as something less, like a tool to do the work who isn't doing the work and is now the problem, and we externally attribute. So I am seeing that, and I'm sure you've seen it, and John, you'll have seen it.
all the time, yeah.
And I just before we move to the positive, like, this is very hard, isn't it? Like, there is no, we'll just change it.
That's what I sort of said earlier. Sometimes you've got to almost break it to go forward. Sometimes you can't build on fractured land. You've got to say, actually, we're going to knock it all down and start again, but together.
Well, possibly. So
possibly, okay.
Well, so my slight challenge to that is, that's almost like there's one person who's right, and they know that it has to all be removed. That is slightly heroic of its nature. Oh, John spotted, it's all rubbish, so he's going to sort it out. Actually, for the future, I'm assuming when we get into the positive side of culture, it's going to feel like we're all part of this. So how we go about dealing with the problems of all this nature, probably comes back to our point earlier. How do we all find we have agency? But you must have been in some dark places sometimes in your career, Helen, where it's felt like, I don't actually know how we improve things around here. Is that fair, or have you always had hope?
So I've never lost hope, I don't think. So I say that as if I'm some sort of Mother Teresa, but actually it's probably because I've just been lucky. So I've worked in lots and lots of different teams, different sorts of teams, clinical, non-clinical teams, and I don't think I've ever lost hope. It's much more difficult when you're not the leader, actually, to affect change. But I've never been. I've observed it, but I've never been in it myself. And I am I have eternal hope. Yeah. So that it would be very hard to crush hope out of me. And I think part of the reason is that because I'm really lucky that I work in the health service, and fundamentally it is the old saying that people that work in health want to help people, and I do think that's absolutely true. And if you can get through to that essence, the essence of why we all do what we do, then you're probably okay, even if it's not so good. But I have observed teams and worked with teams who have completely lost hope, and very senior people and I've sat in rooms with people, again, men and women, who have been so distressed that they have not been able to contain themselves and have been weeping and the discord that's gone on within the team, which is definitely affecting what they're trying to deliver, but amongst themselves, it's spilling out to their social lives, into their communities.
It's demoralising.
It's really demoralising. And I won't pretend that I sorted that out, because I absolutely didn't. It was more of an observation and to say to people who were more responsible than I was, you've got to get this sorted out. And actually, there was some sorting, which was, this group of individuals need some facilitation, need somebody to come in and listen to them. And as a result of that, it looks like people decided to go on different journeys, and the fracture that had happened has repairing itself, and people have decided this is not the bus I want to be on, and they've gone on they've caused another one. But it was through my senses, it was through that facilitation that allowed them to then make the decisions that they made. And it's I would say, a happier place now.
And I think that's right, isn't it? You know, you've given them, like say, agencies say, make a decision yourselves. Is this right for you? If it's right for you, let's work towards something. If it's not right for you, then let's have you move to a place where it's safe for you to feel that you can work. But it's very hard, especially in teams, because personalities are personalities, aren't they? And sometimes people bring their hardship from home to work, and that has an impact. It's a very hard thing to balance. And if you can find the trust, as you mentioned at the beginning, and find that real sort of fun place to be, you can take those little bits on the nose when they come and say, actually, yeah, I'm having a bad day, that's okay, let's work with you on that for today, but let's move on tomorrow, sort of thing. And there's something quite powerful about being able to say to somebody, I'm not feeling it today. I want to come to work, I want to do a good job, I'm not feeling myself, so can I just have 5 minutes? But you can't always do that in every place, can you? You can't always feel that you're allowed to be that vulnerable to say, actually.
But I think what you describe is part of the job of leadership. So I think I love her. I've got my daughter's called them my self-help books, but I have a whole library of books that I've collected over time, most of them nothing to do with health, around different, lots of different things, and I generally read bits and pieces from them, and I think everybody has time. It's what we choose to do with our time, and I think some intentional leadership around what you described, John. So we are all people working in teams. Yeah. We all have lives outside and families and difficulties and joys and outside. And actually there is something about if we can create a space where people can just spend the start of a day 5 minutes about, how's life for you at the moment. And it takes a while to create a space where people want to talk, but actually intentionally leading that sort of thing to say, I might need a bit of support, I'm having a great day today, anybody wants some help, I've got loads of energy. Or actually, do you know what? I've had a terrible argument this morning. My member of my family is very unwell. I am struggling a bit and I might need some support. I think creating a space where it feels safe to be vulnerable, and you have to, again, role modelling yourself as a leader, helps people who are struggling to manage themselves better and to ask for support appropriately rather than dealing with things on their own. And alongside that, I would say that there's something about leaders understanding the impact that life has upon them, being very cognizant of it and making sure that it doesn't spill out in what they're doing. And I think we probably don't pay anywhere near enough attention to leaders realising that how they choose to be in a given situation has a massive impact on the outcome of whatever they do. So I think I realised the more senior I got, the less I did. In that you very rarely roll your sleeves up and do the work yourself. You are supporting other people to get the work done. So there's something for me about what is my job in that role as a leader. My job is to support everybody to do the best possible job that they can do. And what do I need to do in order to do that? I need to be much more sensitive to myself in the sense of knowing when things are irritating me and whatever, feeling that, making sure that whatever is happening for me doesn't get spat out at the people that I'm talking to. So, John, you might come and see me and you might be really irritating me, and I think, what does John want? What does John want again? For God's sake, why can't he get on his job?
But John's not allowed to know that.
So I'm projecting it onto you at the moment, but actually, for me as a leader to be able to sense that is causing me irritation, how that is impacting, how that might impact upon me as I have an interaction with you, taking a breath, managing that so that I am in my best possible state to allow you to be in your best possible state. And I think there is so much stress in our systems everywhere in health and social care, and it's completely understandable. But actually, how do we pay attention so that we manage ourselves as leaders, so we're not projecting it onto the people around us?
No, I think you're really right. It's a real responsibility, isn't there? Not to explode at the top, so everyone underneath you feels that anxiety and that pressure. Something's wrong up here, because that will ricochet through your team and have a real negative, toxic effect for everybody.
Yes.
And it can happen really, really quickly, can't it?
Yes.
If the head of the snake becomes very toxic, everyone becomes very toxic very quickly. So there's something around maintaining positivity. There's something around maintaining how you are perceived by everyone and making sure that you actually are responsible for how you act.
Yes.
But also, like you say, being really good to yourself and understand that you might need to have a coach like yourself. Just because you're a senior lead doesn't mean that you don't need support.
You're still a person.
Still a person. So you might have been put in as a senior director,
yes,
but you might need someone to coach you. You might need someone just to go, I need to offload. And that might be your mum, it might be your dad, it might be your brother, it might be sister, but it might be somebody like you, Dan, and say, Dan, I need to see you once a month just to go, a counselling session, to bring you back down to earth. Because you are human and you're not a robot. But I also think there's a space, isn't there, at senior leadership where you have to be, not so much, thick skin's the wrong word, but you have to be in a place where you can accept criticism, because it will be fired at you quite often, and how you manage that yourself. Because sometimes it's warranted, sometimes it's not. And you've got to decide. And if it's warranted, you have to think, how am I going to fix this and mitigate it? Because I think you said to earlier, you're not always rolling your sleeves up. So you don't always know what's happening on the ground floor.
Definitely.
You think you do, but you don't. So there's something around understanding that feedback loop properly, isn't there, and how you monitor that in a really safe space for you mentally, because there's only so much you can do.
But so you remind me of this, back to some of the work that that Dan and I have been involved in around with some of our American colleagues who are really good at this kind of stuff, I have to say. And you remind me of something that I learned and use all the time called openness to discovery.
Right.
So how do I? So first of all, there is no place in this world for people behaving disrespectfully or discourteously with people. So that's not okay. End of story. However, there are times when you have to hear people want to tell you some hard truths. And it's very easy, as anybody, leader or not, to close yourself down and to stop hearing it. Hearing it. So there are some great techniques that I learned from our American friends around how do you stay open to discovery. So when people are criticising you or people are not happy with the work that you're doing, there might be a lot of flannel in there, but somewhere there will be a golden nugget of something you really need to pay attention to. So how do I, when this is happening to me and I'm getting this onslaught of people telling me that I'm rubbish, how do I keep myself open to being discovered, to be able to discover that nugget that's there?
That's causing that frustration, that little oak that's causing
there's an opportunity to improve. There's an opportunity to do something different, but I need to be in a psychological space where I can hear it. And actually, they taught us some great little techniques around how do you recognise that this is causing you distress. And just give you yourself 5, so your bandwidth can go from, it'll have gone from there to practically there. How do I allow myself some space to go back like this? And some little stock phrases that you develop yourself, like you'll come and you'll have a comment. I'm sorry, you're next to me, so I'm having to use you as my gopher here. But so you come with a complaint, and I can feel myself. I'm feeling criticised, and I think, oh, John, that's interesting. Tell me more. So I've just created myself. It's a stock phrase. I don't have to think about saying it because I've practiced it. So it comes out my mouth, and it's just created me enough space to gather some control and stay open to discovery. So I've stopped myself shutting down. And I think there's some beautiful techniques that we need to intentionally learn.
But that's a really good one, isn't it? Because quite often when people come to you with a criticism or a complaint, they're firing at you, and you have no time to breathe. You're just literally under a barrage of, hang on a minute. So I think that's really good, isn't it? Because you've almost taken control back. You've gone, I'm listening, so now tell me. But don't shout at me, just explain to me how you've got to this, and what are the key things that start this frustration. And quite often it's a bit like all the problems you see in how I found social care, isn't it? We're looking at the problem here, but the real problem's over here.
Yeah.
So you've got to try and say, where's that little nugget leading me
Yes.
to that I can really take on board? And it may well be that it's my responsibility, but actually it might be that I've missed something for you to do or you to do, and let's talk about that together. And then they will probably go, actually, God, have I done that myself? Because quite often these situations are so complex, aren't they? And the frustration is built up over a week, a month,
Yes.
or whatever, and then you're getting the tail end of that.
Yeah.
It doesn't mean that you're not responsible for it, but you may well be, like you say. But if you can create a little bit of void to give yourself time to breathe.
And it allows you to become more objective rather than subjective, because
Yeah.
it feels, if it's coming at you and you feel threatened by it all, it's a very unpleasant experience. You don't take away the unpleasantness of all the experience, but actually by allowing yourself effectively some space, you can almost step outside and become an observer in.
Yeah, that's
And
really
actually,
interesting, isn't
so it's just a reframe, is it? This person is going to, rather than me feeling blamed or criticised, which I probably am being, but actually I take myself into a different frame, think, actually, this person's frustrated about something, there's going to be something interesting for me to hear. So I need to step out of the drama, essentially, and be able to listen to what they say. And the thing about people getting frustrated is they can only be frustrated for so long.
Yeah.
So listen with your ears, not your mouth, and just let them say what they want to say.
Yeah, I do that quite a lot. I will sit down. So even if you get a complaint from the public,
Yes.
I just don't talk.
Yeah.
Until in the end they're repeating themselves, and in the end they just go, okay, well I've sort of said it. Okay, well,
That's
brilliant.
great. Let's have a think about what we do about it.
Do you think, Helen, because your early career, you were a clinical forensics psychiatrist,
Yes.
is that right? Yeah. So you were working with people who have been maybe in some of the old now institutional settings for significant periods, or there'd been a
Yes.
significant event, and they might have been in, like, have the kind of institutionalized as well as serious psychotic episodes, etc. So, I mean, if you think of a circumstance of getting a barrage,
Yes.
you must have experienced this a lot from people in quite distressed places.
Yeah, usually acutely, actually, rather than people who've been in long term. So people, when they often come into the sorts of services that I worked in, are highly distressed, mentally very unwell. They don't want to be there. They certainly don't want to be looked after by me. And because I'm nothing like, I'm a woman. I've worked with men all my life.
Yeah.
And they're in a place that they didn't choose to be. So they're understandably rather upset.
Yeah.
And so I suppose I got very used to people expressing themselves with that level of distress,
Yeah.
and very vocally. And I suppose, yes, I got used to creating a space for people to do that, and a safe space. So yes, it does come from early, and it is a bit of a skill, I suppose.
Well, it is a big
Yes.
skill.
Well, so I got used to listening, because actually, if you try and interrupt somebody who is distressed and unwell,
Yeah.
that's not a good thing to be doing.
No.
You've got to listen.
Yeah.
And you've got to appear to be listening. So there is one of the other things that's important is it's not so much what we say, it's how we say it, and our body language. So there's a lot of, people are much less aware than they need to be quite often of their non-verbals. So I was and I can remember being trained in such a long time ago now, but in how you use your body to create a space for people to be able to safely say what they want to say.
So less of this.
Less of this. It's open up. It's about the openness of discovery again.
Yeah.
It's opening up your body language, and as the way you are with me now, our reciprocal non-verbal communication is incredibly important too, and my tone of voice, my volume of voice. I'm not going to get involved in a shouting match with somebody who's psychotic and distressed. I'm going to keep it calm. I'm going to regulate the speed that I talk. I'm going to be really listening. I'm going to be affirming what they're saying. I'm going to be making understanding gestures and whatever to create that space for people to feel okay to say what they're saying without it progressing to anything else.
So as we've been having a discussion, and you mentioned about your bookcase, I know about your bookcase because I remember being on calls with you in COVID when it was being redone.
A bookcase.
Yeah.
Like my bookcase.
But I've been thinking, a colleague of mine that we both know, Anna Lodge, once said to me, she said, that you could put that in the Book of Dan, which I had no confidence I would ever write a book. I still don't, but her confidence. Just listening to everything that you say, I think there's a book there.
The Book of Dan.
But I do. I think amongst all of your insights and what you've just explained about sort of your background, brilliant intro, isn't it, in terms of understanding. And then we've got these bits of wisdom that you've just shared, particularly about being open to discovery. As we maybe start to move into the final part of this, I just think we should maybe just find some other key sort of bits of advice or guidance that we might give to teams where they feel, individuals in teams or even leaders of teams, where they feel that culture is a challenge.
Yes.
What could they be doing?
Yes.
So the one that I think you've both been talking about without naming it explicitly is how to stay an adult.
Yes.
This is transactional analysis, not get into child
Yes.
or don't react, don't move into a victim mode.
Yes.
Or become a persecutor of others or a rescuer of others. Try and stay as a person with agency who enables other people to have agency. So that's something within
Yes.
a difficult culture. But I also think you've been talking about self-care.
Yes.
You, John, obviously have put in a massive piece of self-care recently. You've done so much physical activity. You're a different person.
Yeah.
Are you gonna keep going with?
Well, yeah, I went to the gym last night, so
Yeah.
I gave myself a week off, and I've gone back to the gym and to keep going. But I think there's something around understanding who you are, isn't there, with self care? So for me,
Yes.
I go through with my weight. I go up and down, up and down. But as I got older, I'm getting to the stage where, John, you can't keep doing that. And what I find is, when I'm bigger, I'm quite lethargic. I'm quite withdrawn. My confidence, although my confidence is still there, it's self-doubt inside because I'm feeling very conscious about myself. So I think there's something really powerful about understanding you person and saying, actually, and for me, if I can get fitter, I can get healthier, I can get slimmer, I can feel better, I can be more how I want to be. That then allows you to be a more positive person in how you are being perceived by people, if that makes sense.
Yeah.
Because you can come in feeling confident, feeling outgoing, you're not feeling lethargic, so you have more time to give to people,
Nice.
have more energy for stuff. So I think there's something around just taking a moment and saying, where am I in my life? And it might be, you know, weight's a really hard thing to deal with, isn't it? You know, for me, it's taken a year of endless gym sessions, endless hiking. I think, was it 150 hours in the gym, which is a lot in a year. And you sort of think, well, that's a big undertaking, but I'm a very different person than what I was a year ago. And I think that allows me to also to be more open in my thinking. I feel that my thinking's faster. I feel like I'm more alert, and I can take things in my stride more, if that makes sense. So I'm also dealing with people like you, so I'm purposely
Dealing with.
dealing with.
Sorry,
That was
John.
a terrible phrase.
That was a terrible phrase. Yeah,
Coping with.
suffering against. So I've also obviously tried really hard to sort of engage with people like yourself, Dan, who are really a positive influence on my life, and hopefully vice versa. And I think you've got to make sure you surround yourself with really positive people, and not be afraid if somebody really is dragging you down to almost not avoid them, but say, I can't do this.
Yeah.
I can't be involved in this because actually it's really hard for me because of A, B, C, and D.
Yeah. Yeah, good.
That's for me. That's
Yeah.
my reflection on the last year.
Yeah. What about you, Helen? As we move towards close, other advice that you might give to people in difficult cultures for how to not just survive, I suppose, but get stronger
To
to
thrive.
Yeah.
Definitely. So I think one of the things, and that is, one of the pieces of work that I absolutely love and use all the time is some work that my colleague Matt Hill did, who's an anaesthetist down at Derriford at Plymouth, and when he was the national culture lead, around how do you create a positive patient safety culture. And one of the aspects of that, so I use that framework all the time, but one of the aspects that I particularly like and will really fit with what you're saying now is that we only focus on team when team's in trouble. We don't focus on creating healthy teams from the word go. And that is not about the work that they do necessarily, but it's how do you create trust and relationship between teams? How do you have some fun together? What sort of activities could you do as a team to help you bond, understand each other, build the sorts of relationships that when somebody is not functioning or is not there anymore, that everybody knows how to stand in for each other? Because there's so much evidence to suggest that teams that do that kind of work function much better, even when they're very stressed. And so if you're an employer you're thinking, well, I want my team to be doing 20% more than I'm paying for them for.
Yeah.
That's important, but actually it's associated with happiness. You know, everybody knows that they like working in a high functioning team better.
Yeah.
And sometimes it happens by accident, sometimes it's good leadership, all of these things, but we should be much more intentional about building teams. And we know, you know, I've worked in a number of organisations that have got organisationally grotty cultures, but within those organisations there are little nuggets of joy where there's teams that are really, really high functioning. When you go to the team, they've got a lovely culture. And that's because they've worked as a team on their culture together.
Yes.
They haven't called it culture, whatever, but they've worked on how they choose to work together, how they build trust, respect each other, all of those sorts of things. So if I had to say one thing, I'd say really focus on building your team trust and relationship. Get out, go and do a pub quiz together, do some team building together.
Yeah.
Focus on things that matter to you as a team. Get to know each other as a team.
Yeah.
One of the things that I really like as well, I really agree with all that. I think one of the things that I'd add into that though is also don't forget to expose them to the outcomes that they're creating.
Yeah.
So certainly, you know, if you're doing some incredible work around patient safety, you've had some brilliant feedback, make sure you feed that back to them. Look at what you've achieved.
Yeah.
So it might be hard, it might be pressured, but look at these wonderful feedbacks that you've got. You've done this, and make them really proud of it.
So you've just reminded me of another really important element with any improvement work that you do is communication about it. We fundamentally failed to think about how do we let them or anybody else know that they've done a good job.
Yeah.
And I learnt a lot from my colleagues at East London Foundation Trust and then actually the Royal College of Psychiatrists, the National Collaborating Centre there, that they're really good at comms. So they really publicise to the world what's going on. But to the teams too, there's constant recognition, and the way that they use their information, their data, their performance, etc., is done in a way to complete that feedback loop. So constantly reinforcing the behaviours that people are exhibiting, and we don't pay enough attention to that. And people that do absolutely get dividends from it.
I think it's a real wonderful feeling, isn't it, when you've been working really hard and suddenly you see a smile on a child's face that you might have changed their life for some reason, or an adult or something, or you've really helped them to get home, even if they're going home to pass away, but that family's thanks, you know, if you've been a fundamental part of that and you hear that, it suddenly makes it all worth it, doesn't it?
Yes.
It doesn't, and like you say, that's in social and health, but it could be in any industry.
It's back to purpose, isn't it?
Yeah.
You're reinforcing, people are back to having their purpose reinforced, and that's lovely.
Yeah.
I love that. I'm always kind of surprised when, I remember years and years ago, something happening and somebody recognised our team's work, and I was part of judging of another bit, and I thought these things are all a bit cheesy. And then actually, I can remember on the day, and our team won, and actually I felt close to weeping. It was, I felt a real emotional response to it. So everybody loves it, doesn't matter who you are.
Yeah.
Okay, so I'm going to thank Helen. Helen, that was brilliant. Really enjoyed it. I just want anybody that's listening to also know that everything that you've just said, like, I've seen that delivered. You're amazing at it. And if they are aware of teams in, significant areas of challenge, you and your network could be really helpful to them.
Thank you.
And to reach out and to contact you.
Thank you.
John, thank you for today.
Well, thank you, Helen, for coming in. It's been
pleasure.
lovely to meet you, and it's been lovely to meet the other half of a really incredible person who I know too. So say hi to him when you get home.
I will.
But it's been lovely to actually have this conversation and be able to really dig down deep into good, bad, and indifferent. Really. So thank you so much.
My
And
pleasure.
Dan, thank you for hosting.
No worries. We will see you again next time, and take care.
See you later. Bye-bye.
Bye.